Hi, my name is Naz Baecher. I am a preventive medicine resident at the University of Rochester Medical Center. We're going to be talking about tips for managing blood pressure and hypertension and preventing stroke and heart attacks today. So the key points we want to discuss are who, what, where, when, why, and how, which is also the format used in major journalism. So why are we giving this talk? It's because the number one leading cause of death in the United States and worldwide is heart disease and stroke. So let's talk about the how. How can high blood pressure lead to stroke and heart attack? Basically, when you have high blood pressure, you cause blood vessel damage. And once you cause blood vessel damage, it narrows the arteries, and then eventually it'll lead to very low or no blood flow. Now, no blood flow to the heart causes heart attack. No blood flow to the brain causes stroke. And again, it is the number one leading cause of death, so that is why we care. About 87% of strokes are caused by the narrowing or clogging of blood vessels in the brain, and those are called ischemic strokes. So basically, when your blood pressure is too high for too long, cholesterol starts to build up in those blood vessels and can narrow it even further. So why should we care about high blood pressure or narrowing of blood vessels? So we mentioned heart attack, which is when high blood pressure damages the arteries in the heart. And here you can see a picture of cholesterol building in an already narrowed vessel. We also talked about stroke, but we haven't talked about vision loss, which high blood pressure can strain or damage the tiny blood vessels in the eyes. Sexual dysfunction is also another big problem. Basically, in men, it could lead to erectile dysfunction, and in women, it could contribute to lower libido. We haven't talked about the kidneys. So basically, all small vessels, major vessels in your body can be affected by high blood pressure and cholesterol buildup. And peripheral artery disease is not, there's no graphic here, but you can see it in this picture. When it can cause pain, numbness in the legs and feet. So who has hypertension? Nearly half of all Americans have hypertension. And this is a geographic distribution of the highest percentage of hypertension in 2017 in adults ages 20 and older. So as you can see, there's a high concentration right here, but essentially it is a nationwide problem. So 1 out of 2 people in your life has high blood pressure. Even if you don't have it, you know somebody who does. What is hypertension exactly? So it's high blood pressure. Normal is a systolic, the upper number, below 120. And this is measured in millimeters mercury. Diastolic, which is the lower number, is below 80. Anything above 120 over 80 is considered elevated or high blood pressure. So this upper number, the systolic number, indicates how much pressure your blood is exerting against the arterial walls when the heart beats. So when it contracts, we measure the pressure against these walls. Diastolic, which is the lower number, the second number, indicates how much pressure your blood is exerting against your artery while the heart is resting in between beats. Both numbers are incredibly important, but typically we tend to focus on the higher number. So this is normal pressure on the walls at 120 or below. Increased pressure on the walls, as you can see, it's causing damage and cholesterol is getting in there. narrowing it even further. And here's an even more increased narrowing. So where do I go to get my blood pressure checked? It's a great question. And the correct way to measure blood pressure. So any local drugstore at home or at your doctor's office. You can ask your insurance company to see if your blood pressure cuff is free. Drugstores sell them over the counter at a low cost. And at the local drugstore, you could typically find a blood pressure machine that you could check your blood pressure for free. Try to avoid wrist blood pressure cuffs because they often give inaccurate readings. Usually they read higher than you actually typically are. So the correct way to measure blood pressure is very important. So no talking. You have to have your arm resting at chest height and cuff against bare skin. So you should remove any clothing in between the cuff and your skin, and make sure your back is supported with your feet flat on the floor, not crossed. So when should we worry? So let's say you went to the drugstore, you measured your blood pressure, and you're reading above 120, at or below 80. So if your blood pressure is above normal more than twice, you should probably start questioning your doctor about what you should do. So how often are you recording it? Where your blood pressure should be depends on other, what we call comorbidities or risk factors. So it depends on your age, your sex, but typically we want almost everybody to be below 120 and below 80. Now, why is this important? Because over time, when you elevate blood pressure, this type of damage occurs over years and years. So it is the biggest risk factor for stroke and heart attack. How do we lower our blood pressure? There are things you can do yourself without the help of a doctor or a healthcare practitioner. Exercise and diet. You want to start with small changes. So you shouldn't go running a marathon or just not eating any salt at all. But these are things you could do. You could start by walking 15 minutes a day and increase it slowly. Chores around the house. The more the better. Diet, just start by not adding salt to everything and eating vegetables. You have to keep track of yourself, hold yourself accountable, and monitor your blood pressure. Again, we went over the ways to do it and places to get it done. And stop smoking. If you're smoking, it's the number one risk factor for practically anything. And take charge of your health. You care about yourself more than anybody else. And ask questions. So things that we could do as physicians, we can diagnose you with high blood pressure. You come in after recording it yourself at home and you're wondering whether or not you really do have high blood pressure. We can give you a confirmation diagnosis. We can advise you as to how to do all of the things that you need to do in order to lower your blood pressure. And we prescribe medications to lower your blood pressure if these are not enough. And typically they may not be. And we're going to look for other diseases that may or may not be causing high blood pressure rate. It could be that you have a list of other diseases that we need to look for. And the most important thing we need to do as doctors is listen to you. And the most important thing you need to do is take charge of your health. So call your health insurance, ask your doctor for advice and referrals. Some questions you can ask is, do you know of any programs I can join? Are they covered by insurance? Do you have a dietitian that you could refer me to? And can I pay with my HSA? Thank you very much. And remember, take charge of your health and lower your own blood pressure.